Okay, viewers, this is Dr. James VOND, or VOND Dutch in full, and today's date is now Tuesday, 9th of December 2025. And in my previous video, which I made a few minutes ago, I was mentioning something about my painful abscess in my back side of my teeth at the back end, on the right hand side, that is, this end. And it's a painful infection there. Therefore, the abscess, that's what's causing the pain, and it goes sometimes all the way down to the root canal, and it might require extraction of the teeth. And in fact, it's so painful, the pain goes up to the cranial, and it's been affecting my everyday ability to do things today. It's excruciating pain, and although I mentioned that you can buy over-the-counter prescription without prescription analgesics, that's painkillers such as standard brufen, ibuprofen, or paracetamol to alleviate the pain. It's not really that effective, and obviously you need a course of antibiotic treatment to counter the infection, the abscess infection, and any dentist would put you on a course of antibiotics immediately. That's the standard procedure before commencing with any treatment, to either remove the extract the teeth, or to even maybe put a filling, a resin filling, for instance. But prior to that, the standard procedure is always to get the patient to have antibiotic course of treatment, usually lasting up to about a week. And that they won't start any treatment without that. Obviously, that's the standard procedure, and you can't just walk into a pharmacy and buy yourself antibiotics. I've got to mention that as well to my viewers. That's the downside of things. Obviously, unless you're working in the NHS or something, you can actually get these prescription drugs uh, through them. Obviously, in the professional world, but most people like myself would not be able to do that if they're not in the services there, employed in those roles, and therefore you have to rely on what's available over the counter. And the only thing that's available really is the analgesics such as paracetamol, like I mentioned, and ibuprofen, and you can't just buy yourself antibiotics. So I did mention that you can get mouthwash. Of course, everyone knows that, even from the shops and superstores. That's antiseptic properties there, which is useful, of course, rinsing out with mouthwash. There's a cheaper version here as well, um, slightly cheaper one. And this is my standard toothbrush paste that I use, the Aquafresh brand. I don't use that obviously since last week, since I bought these items. I bought some toothpaste, invested out of my own pocket there, the Sensodyne brand, but that hasn't seemed to have helped that much. There's a rapid relief one, which you apply to that affected area. You can actually massage it onto that back tooth, that painful abscess condition, to alleviate the pain, but it hasn't helped that much. Obviously, you need to start a course of antibiotics. Usually, as amoxicillin, standard standard issue procedure, and lasting for about a week or so. So that's what I'm on at the moment, and I've been prescribed that after referral by NHS 111 service in the UK, with access to any dentist there in the local area. And I mentioned the Park Road one. That's obviously the one that's more closer to me. But my appointment won't be actually there for the treatment. It'll be at some other place, a different surgery altogether. So I've got their numbers. I've got an appointment booked with them after this follow-up assessment, initial assessment, and also the prescription that was prescribed today, the antibiotics, amoxicillin antibiotic capsules for the infection, that is. And like I said, you can't just buy that. So over the prescription, you have to actually see one of them dentists. Although I was thinking of doing it myself. I mean, I have in the past done some things, dental work myself. You can buy quite a few things from eBay or even Amazon, and treat yourself. I mean, I'm quite usually, self-treating person normally, but I'm a bit like that Mr. Lopez, in Handy Money. who doesn't want any help usually, almost like that kind of, and not Jennifer Lopez, but that Mr. Lopez guy in Handy Money, that cartoon character. He doesn't want no help ever. Remember him? But obviously, below the belt area, obviously, I don't mind, especially sexy women. But that's another issue. But they don't really approach me for that, do they? I'm no Mr. Lopez there, put it that way, anyway. But of course, I even do my own haircuts, and I've mentioned that in my videos. And obviously, I shave or trim my beard sometimes when I'm doing that myself as well. And obviously, I do toothbrush myself, and I don't usually like to share these sort of things, and I'm kind of fussy like that. And I even use hand gel and things as well, which you can buy. They had that during the COVID days as well, but you can get that as well. So sanitation wise and hygienic wise, I'm quite, there up the medical side of things. So just the important point to remember is you can't always buy these things, these products. They are restrictive products, and even for people like myself, with my sort of background, university background, they won't necessarily just hand them out or something. And then you have to obviously get to see one of them dental practices or something. If it's a dental specialist, you might need to see. So it has been affecting me anyway, but I've made some videos today anyway. But my viewers need to be made aware of that issue. So it has kind of caused quite significant problems for me, and it has been bothering me for a week or so at least, maybe more. And I've tried to remedy it, and I had to resort ultimately to getting them to see that it was an abscess, an infection in the back molar teeth there on the right hand side, causing the pain and extending upwards to the cranium. And so that's it for today anyway. So you can still carry on with the treatment with yourself. You should still, if you have any, do maintain oral hygiene, with the mouthwashes and the brushing. But if you've got an abscess, you'll have to get antibiotics for that initially, obviously, just to stop the infection spreading further, causing the pain. And then obviously it might be an extraction that might be involved if they can't fill it up with a resin filling or something. Dr. James VOND on early hours of the 9th of December 2025, and it's a Tuesday.